Please welcome to the stage Global Product Lead for Digital Health Strategy at Garmin Health, Travis Johnson. Chief Technical Officer at Verily Life Sciences, Brian Otis. Head of Healthcare Products for Nokia, Nicolas Schmidt. And moderating our discussion, Principal and Founder, Person-Centric Solutions and Ideas, Dennis Robbins.
Hello, we're delighted to be here today. I'm standing because I'm the oldest one in the group, and I know that sitting is the new smoking, and I know we're all about health without the vowels, so I'll be up here. I'm just really delighted to share the podium with these folks, non-podium with these folks. One of the things we've been hearing a lot of, and I find when I go to a lot of healthcare conferences and medical conferences, is people become very uncomfortable sort of talking about who's the person we serve and who we're all about. Sometimes we talk about patients, and then even in the first panel here, people were talking about patients, and then they were talking about members, and they're talking about people, and we don't know who they are. From my perspective, we're people 24/7. And if we want to make a difference in people's lives, we should work in that life space and make it meaningful, important enough to make a difference. I find patients to be subservient, passive, wounded, vulnerable, on an equal footing. People can do anything if it's done right. And we're going to talk about how to do some of that right and really, really make a difference. Yay, verily, we will do it. So
that never gets old.
Let's get started. So, you know, all of you come from different spaces but do very cool things and have different foci or focal points in terms of what makes a big sense. Brian, I'd like to start with you. One of the things that's very exciting to me about your company and the kind of work you're doing is that you cross a whole variety of platforms, actually a platform of platforms, and are doing things that are really, really cool in the life space. Can you tell me more, please?
Sure. So one of the things that I am personally extremely passionate about is creating new types of tools, new types of devices for collecting these signals that are previously uncollected. Like we've talked a lot about wearables today. We're working on a device called the Steady Watch. It has a lot of physical sensors and a lot of physiological sensors, optical heart rate, electrical ECG, electrodermal activity, in hopes of collecting these signals, but also the context of what the user is doing. And another one, to get back to the theme of what you just mentioned, is liftwear. It's a device, a set of utensils that has sensing, computation, and importantly, actuation to cancel out tremor. So if a person has a severe tremor, these devices will help them eat more independently. Getting back to the point of not just foisting technology on the user, but giving them something that helps them day to day. Another example, and we heard James talk about diabetes, we're very interested in creating new tools to help people with diabetes. We have a partnership with Dexcom looking at easy to use, low-cost continuous glucose monitors that are really small and inobtrusive to hopefully allow us to provide these technologies to a broader swath of the population of people with diabetes. And I think the reason that we're so focused on these types of tools and collecting these types of signals is because at the end of the day, we think it will help empower the users and, from a healthcare perspective, empower the health coaches to kind of have a peek under the curtain of what's happening between doctor visits, where we have very little observability at this point. Secondly, having this information allows us to be able to look at outcomes, track and quantify health outcomes over time. We heard in a previous session about how we're moving away from pay for service. But if we do that, we need to be able to quantify and look at these health outcomes in a granular way, and some of the tools that we're working on will help us do that. Finally, trying to create a situation where healthcare is more proactive instead of waiting long, term down the disease progression path. Get in early, and they can talk about the ways that we do this as well. But one of the big ones for all of you is none of us can do this on our own, and we at Verily rely on partnerships to do a lot of these programs and develop a lot of these products. So I'd love to talk to you all about potential and future partnerships.
Excellent. So, yeah, how do you choose some of your partners? You've got some very big players. How do you define your priorities of how to move forward in terms of making a difference?
Yeah, actually it's pretty simple. It's looking at how our capabilities are complementary. In the device space, we've Verily realized that we really need to have a broad, vertically integrated engineering capabilities set. Integrated circuits, battery development, microfabrication, antenna, electromagnetics, of course, firmware, software, manufacturing capabilities. But there are a lot of capabilities that we have the best partners in the industry who can help us out, and we can help enable their business as well. So it's all about finding partners who have complementary interests and the best in the business.
Best in class, absolutely. Travis, one of the interesting focal points of your company that I've learned is that your sense of accuracy of your algorithms. A lot of what you do is tailored towards the elite athlete and really make a difference. You do much more. Can you share kind of what's going on in your space and how you see this in terms of the bigger picture?
Yeah, absolutely. At its heart, Garmin is an engineering company, right? And I think that's one of the key differentiators for us in this market, and especially in the health market, is that we really approach it from the ground up. We do all of our own manufacturing. We understand all of our own algorithms because we're the ones writing them and we're incorporating them with the sensor. So we can be very sure of the high quality and high accuracy of both of our data and of the device itself. And I think that you mentioned performance athletics. I think that's one of the reasons Garmin's been doing wearables since 2003. It's one of the reasons that we've really resonated with that community is because of the reliability, the rugged ability, and also just the ease of wear and use. And as we look at health, one of the things that I think is a really interesting parallel and that I think Garmin's very well situated to address is really meeting the user and meeting that person, right, where they are. And we've done that on the performance side. We do that on the wellness and health side with our activity trackers and smartwatches that are meant for people just getting into fitness. And that's going to be even more key as we work on things like home health care. And maybe somebody who wouldn't normally wear an activity tracker but now is wearing one of them as part of their care plan. And they don't want to be worried about having to charge it every day. And they want to be able to sleep in it comfortably because a lot of the really interesting metrics that their doctor and their care staff want to know about may be during sleep. And so we want to make it as seamless as possible so they don't have to take it off. And that's years of engineering around battery life, performance, and accuracy and reliability.
Now, doesn't that granularity sometimes get in the way for new products coming out?
I don't know if it gets in the way, right? But it's certainly, we want to be good at what we do, right?
Exactly.
So, yeah.
Exactly. So, Nicolas, you're more of our clinical guy here with the work that you're doing at Nokia, and share something about your passion and what you're doing and what you see as being the future and how you see this in the lighter thing. Because think about it, if we're talking about measuring activity, we're talking about sleep, we're talking about healthier eating or avoiding processed foods and the like. That's really about health, not medical stuff. That's about our life, about making our life better.
Yeah, so we're much more about wellness. We're more about health and wellness, as you said. And so, for those not familiar with what we do, so I was part of the Withings team that Nokia acquired in 2016. And we have an ecosystem of devices, so activity trackers, but also more medical devices like connected blood pressure cuff, connected thermometer. We also have a sleep pad. So for us, there are two big elements to that. The first one is sustainability. And so we really think about the user experience and the design. A lot of people, a lot of companies talk about that. But in practice, when we design a sleep tracker, it's not something you have to wear. It's not something you have to recharge. It's just a pad that goes underneath your mattress. It's there. You don't have to touch it. It will seamlessly collect your data, transmit it to your app, and you really have nothing to do. So completely seamless experience. And we believe, health technology shouldn't come into your life, be a barrier. The technology really should be totally invisible. So that's the first point. And then what I'm really passionate about is, okay, now that we have consumers that are getting more engaged, that have all of this data, some wellness data, as you said, but also more medical data, how can we connect all of this to the healthcare system? And so we work quite a lot on this, and I would say on 3 different levels: the individual level, the kind of community health level, and the society level. So on the individual level, if I take the example of blood pressure, for instance, we have developed a program that's a 5-day program that will help basically our users assess their blood pressure status. So blood pressure can vary so much during the day based on what you've been eating, your activity, even your stress level. So we have developed this program that is clinically validated. We published it. That will give you a clear assessment of where you stand. On the what I call community health, we work quite a lot with partners in the health system field to connect our devices to their systems, their EHRs, and make sure they can leverage all of this. So we have a few programs around digital chronic disease management, where basically a patient that goes see his or her PCP is diagnosed with hypertension. They will get a prescription to get a Nokia blood pressure cuff. They can go to a location within the health system called the tech bar most of the time, where they can buy the device, they can get some help to set up the device, and then all of the data will flow into the EHR, and there is a comprehensive care program that's around it with education, coaching, med titration. So really making sure the data can flow seamlessly and patients are engaged and more empowered. And then on the what I call society health, we engage with researchers to make sure we generate new insights. So I can give you one example again on the blood pressure field, where we've been working with Scripps. Basically, we looked at some of our data set on blood pressure, trying to figure out, okay, what's the normal variability of blood pressure? If you are a male, 40 to 49 years old, in winter, on a weekend, how much should your blood pressure vary? And so nobody has done any study on that before, just because, well, if you try to do a clinical study, you're going to recruit 100, maybe 1,000 patients. That's not enough. We had millions of measurements. And so we published in the American Journal of Cardiology with Eric Topol and his team some benchmark indexes on what is a normal blood pressure variability. And so you can see here the next step then is to connect this with more clinical data and then be able to associate a risk to your blood pressure variability. So that's really how we perceive it, both from the device perspective, making sure we get long-term data, sustainable and invisible technology, and then connect you to your clinicians and make sure we make sense of this data at a medical level.
You know, Nicolas, the thing you mentioned about sustainability is, it's such a big deal. I mean, we're trying to create these tools and gather these signals that will possibly prevent somebody from, progressing in their disease 5, 10, 15 years from now. But it's hard to see that acute need day to day. And so we think about different ways, and I think we all do, and James mentioned this in the previous talk. How do we keep this engagement alive for a period of not just months, but years? And for some of the tools that we create, like Liftware, it's a pretty easy case because this helps the person day to day eating independently. That's fine. But if it's a different device, there are different ways we could do this. Integrate this type of sensing and capability into devices that you wear anyway, like a watch, other wearables. Or if that's not the case, it has to be data that can provide useful and not just reams of time series data, but useful insights you can actually do something about day to day. Or, like you mentioned, the bed sensor, something that it just disappears. It just seeps into your environment. You don't even need to touch it. You don't even need to look at it. But if it's something that you need to interact with, that engagement needs to be there, or it won't be sustainable.
And that's really key, because if you think of it from a fitness, wellness perspective, a tracker or a plastic band, it's fine for 3 months, 6 months, and don't get me wrong, it creates clear value, like you become more active, you become more aware. But if you are talking about health, if you are talking about medical, 3 months, 6 months of data, it does no value. What you want is to create a baseline and see the deviation from your baseline in 5 years, 10 years. So that's why, for instance, on our wearable, we said, okay, we're not going to go with a device that you need to charge all the time that have this button. We just created a watch like that. So it looks like an analog watch, but still it tracks your activity, your sleep, your heart rate. And so it's completely hidden. The first reason people use it is because it's a watch. It shows you what time it is. And then we collect all of this data. And in the future, we hope we'll be able to give you more and more insights on your health.
Yeah, I think that what I would add to that, I think of that concept as like the second screen, third screen, fourth screen experience being driven from the same device, right? And that's what I think will help keep people engaged with their wearable. Of course, the Garmin features are there to help them with the things for their activity, right? But there are many really interesting just engagement platforms, health platforms. You know, Garmin's also part of the United Healthcare Motion program that James mentioned earlier, and that's a great second screen experience on our devices. That's giving you financial incentives every day to keep that on and to keep active. And it's an ecosystem play, right? This isn't just Garmin's device. That's truly my viewpoint. It's also all of our partners' devices, right? And I take it to heart as product manager and for this group to make it as easy as possible for our partners to get that data off of our devices into their platform, whether that's through our APIs. We have SDKs that allow direct device access. You can get streaming data from them. You can make the device completely yours and take over the whole experience too, if that's what's needed. It's really meant to be whatever that person at the end of the day needs it to be for their life.
Excellent. I'm going to jump back to Brian's point and have you respond to this as well. So, you know, we always talk about promoting a healthy behavior, or promoting a behavioral change, or a way to get adherence or the like. And, you know, it's easy enough to promote a behavioral change in terms of someone losing 5 pounds and keeping it off for several weeks or a few months. But keeping it off long term and that sustainability, and even the next step, where it becomes embedded in a lifestyle and really becomes a habit, becomes part of your life. You know, that's one thing. How do we do that? Or what are the barriers? Or what's your thinking?
So one example that comes to mind when you bring this up is a company Onduo that Verily has jointly created with Sanofi. And what we've learned with Onduo is that if you can give these insights directly to the user, for example, okay, then there's deep CGM, continuous glucose monitor integration with the Onduo platform. Well, you can, over time, learn, okay, well, if I eat this, this is how it affects my blood glucose. And then there's the coaching aspect as well, where there's on-demand health coaching for this interactivity. And that's one where just the engagement is there. Day-to-day eating is a big part of it. You have that engagement meal by meal. And that's one where, you know, it's this small sensor that you wear. It has integration with this platform. And over time, you can learn about your body. And that gives a lot of engagement.
Excellent.
Yeah, I think that it's, what I've noticed is that each new metric that Garmin adds opens up another line of conversation, not just with your friends, but with coworkers, your general social circle. And I'll take our stress score as an example of that in mental health, right? I know that even just the people that I work with, as soon as we all started wearing it, well, the instant thing you do is, well, what was your stress score today? Is it low? Is it high? Oh, I saw who you had that meeting with earlier. Are you doing okay? And then it became even a whole conversation about how do you manage your work stress? Oh, do you take moments every day to like rest and kind of recover from that? Or are you type A? Do you just go through it? I tell you right now, if you could see my streaming B2B intervals, they would be very rhythmic. I'm quite stressed up here. But generally, when I'm in meetings and people think, oh, that must have been a really hard exec meeting, I'm like, no, it was fine. I could look and I actually was okay. So, but that echoes across every metric, right? It started with steps. You know, 4 or 5 years ago, it became about METs and intensity minutes and sleep, right, and stress. And then the next things, the things we are just on the verge of being able to talk about now and open up that conversation, I think that drives the engagement for people.
Before Nicolas jumps in, I noticed when I look at your stress on your watch, I'll look and I'll see that I have a high stress at a certain time. And you know, I say, is that conversation I'm having, did that phone call really bother me that much? I really need to be more attentive, more vigilant, more mindful of that kind of thing. And it becomes a companion. It becomes part of my life.
It does, and it's about how many times that happens to you throughout the day, right? Because it's peaks, and it may not be so much that you were like emotionally stressed by it, but that you were on and focused and wanting to be really engaged, and that in itself is its own kind of physiological stress. So I think it helps people be cognizant of how quickly their battery is draining throughout the day, right?
So Nicolas, before I come to you, I want to have you answer this. So one of the things that's really interesting we often hear is, well, these devices, these trackers and that, I mean, they're really great. They give us information, about our sleep and about our activity and our caloric intake and stress and the like. But what does that really mean clinically to make a difference for the average doctor? How do they integrate that into workflow? How do we have them understand that's really important? Because frankly, they weren't trained about health. They were trained about managing illness and disease. Rescue reactive care towards acute episodes. How do we make that happen? What can we do? Where do we get that stickiness? You're first.
Can jump in. Well, first, I think you have a difference in the wellness data and the wearable data, where there are not a lot of relevant biomarkers right now that you can derive from a wearable, from a clinical perspective, and then more of some medical connected health devices, so blood pressure cuff, EKG, and so on and so on. On this part, I think it's very clear, like if you have more blood pressure measurements on your patients, it helps you with med titration, it helps you with coaching. And so we have more than 50 health systems in the US that are directly integrating our data for their patients to provide care. So on that part, I think it's more about scaling and finding, the right business model, reimbursement, and a few other things. Then on the wearable part, I think we're still very early, and we'll need to derive new knowledge. And so there are two ways to do that. I mean, the first one is to partner with researchers. So for instance, we launched an initiative with Stanford Medicinics about a year and a half ago where we asked a team of researchers to submit ideas of what they would like to do with our device ecosystems. So we got about 50 different pitches, selected 5, helped them with devices and different types of support to conduct their study. And so we just released who was the winning team, and so this team looked at wearable data after you get knee surgery, knee replacement surgery, and how it's linked to opioid consumption. And so for instance, what they found is that there is a pretty good correlation between your sleep data on day 2 and day 3 after your surgery and your total consumption of opioid during the first 30 days. So basically, it can give you some idea, on how to prescribe the right amount of opioids, how to better personalize your treatment.
Excellent.
But we need to generate this knowledge. Same thing with the heart rate. Right now, nobody knows what to do with continuous heart rate data.
Yeah.
We just need to do the research. We need to partner with people in this room and kind of derive the knowledge. So I'm sure it's going to arrive and be useful. But yeah, right now, if you give a doctor like the data coming from a wearable, most of the time, if it's not in a very clear disease and or condition, they have no idea what to do with it.
But Nicolas, I'm not going to let you off that easily. I know that if I'm sleeping 5 hours a night, it's going to affect my health. We do know those things. Why do you think there's reluctance to take some of the sleep information and act upon it? We know that if we have 6 hours of sleep, it's being equivalent to being 16% intoxicated. We know that if we have an adequate sleep, our caloric intake for carbs, or carb intake, will be 33% higher. There's a number of things we know, and we know this about sleep, and we've been researching sleep for a while. Why is there such reluctance? And he's going to jump in, and then you can come back. Go ahead.
Well, I was just laughing because with that statistic, I'm surprised I can sit on this chair.
I know,
I'm sober
amazing.
right now based on the number of hours of sleep I had last night.
That's why you're so mellow.
Well, I
Travis.
can't decide if it's me or if the chair is wobbly now. I don't know what to do. I don't know what the reluctance is. Is it on the part of the medical community? Is it part of your own responsibility to take a look at that? I know for myself, I try to get more than that. I try to get at least 7 because I know that it affects my performance and how well I can do my job every day. But some people don't have that luxury, and I think taking the conversation back to the person again, it's really tough for some people to do better than that. And I don't, certainly, better intervention from trusted sources like healthcare staff, whether it's minute clinics or your actual PCP. I think over time, if that data was coming through and they see long-term trends of you having great sleep debt, someone should intervene and at least provide the educational materials so that you can make an informed change or choice or ignore it, right? And I think
Certainly.
that's where the responsibility
Certainly.
is.
No,
Yeah,
go ahead, Brian.
and I definitely agree with Nicolas. What we can't do is provide reams and terabytes of raw data to a healthcare provider. It just doesn't make sense. But there are a few ways that this data can be useful. One is, as I mentioned, is giving continual nudges back to the user, like trying to keep your blood glucose within range. We have that instantaneous feedback day to day. The other paradigm is something that is collecting this data that can be constantly vigilant. They can just observe and watch progression of health outcomes over time. And of course, that takes the computational and analytical element to be running to make that happen. But to get there, I think we're, as a community, still early. To get there, we need the data, we need to run the studies.
Certainly.
I mean, as you said a bit earlier, we're already in a system where it's all about treating episodic, all about episodic care more than continuous care. We know it's not the right way to treat chronic disease, but that's what we have. First, taking into account, sleep activity, it's just not part of how the system is built. Then I think as a consumer tech company, we can also help you. We don't necessarily need your clinician to tell you need to get more sleep. It's something we can just do on our own as well, and that's where consumer empowerment, having great data analytics, being able to generate insights is also helpful, and these are pretty basic insights, right?
So besides making something person-centric, we also need to make something clinician-philic or clinician-friendly and be sensitive to workflows so it can be accommodated. How might we approach that, or what innovative things are you doing in that domain? Start, Nicolas, please.
I mean, first, very easy technology to use. When you see your patients, you have 10 minutes. It's once in a year, maybe 4 times in a year, if you have some form of chronic disease. So make sure the physicians are comfortable with this tool, both in terms of technology as well as in terms of quality and accuracy, data privacy and security. So making sure that the box are checked there. And there is some interesting work that's currently going on with the Consumer Technology Association, trying to create some form of standards around this. So I think that's kind of the first really important point. And then it's about making sure it feeds into systems that clinicians are already using. So native EHR integration. Nobody wants to have to jump between 10 different systems based on your condition or what is the brand of the device you're using. Making sure we don't send data without any end goal. So if you want to access activity data, it should be linked to a specific program, say hypertension, where you have a clear target that has been clinically recognized that you need to achieve. And so I think really making clinicians feel comfortable with the technology, and then making sure we don't do any data overload. So we integrate in the system, we have alerts in place. Are for me the two really key elements on that.
Thank you.
Yeah, from our perspective, it's pretty simple. It has to be technology that's easy to use, doesn't require a lot of training, saves clinicians time and allows them to practice to the height of their license. And those are principles that aren't tacked on in the instructions for use at the end. Those are things that need to be designed in from the beginning.
Yeah, and I know from my perspective, one of the things that I want to make sure is that as Garmin continues to transition, especially with the Garmin Health Group, is we create solutions in this medical realm, right? I want to make sure that the solutions that we're providing can really be trusted by clinicians, and so that they know a person wearing a Garmin device that maybe in the future detects a heart arrhythmia or can screen for apnea. We've got a great partnership right now with the University of Kansas Medical Center, and we have these studies undergoing. But in the future where we can do those things, I want to know that that provider getting that alert knows, and a person coming to them knows it, it's been trusted, it's been verified by the FDA, right? And that they know for sure that this is something they can trust and that they should act on it. Because what I don't want is for us to be contributing to more noise in that space, because the system's already burdened, right?
So let's shift a bit away from the clinician and the clinical environment back to the person for a moment. So for me, personally, I'm concerned about my health. How many times I go to a physician here? I rarely go. I walk 10 miles a day. I do other kinds of activities. I'm mindful about how I eat. I try to sleep enough and so on and so forth. And that's made a huge difference in my life. And having one of these, and whether it's a Withings product or a Garmin product or a Fitbit product, I've used all of them. Happen to be wearing a Garmin now. But can we shift the conversation too away from just how we can improve people's lives and make them more mindful? For me, health is about mindfulness, balance, resilience, readiness, endurance, hardiness. And that shapes my world. I mean, people often say we just need more prevention in our system. In fact, we had one of the best people in the world, Dean Ornish, just speaking about this. But I've never woken up on a given day, maybe you have, looked out the window and said, my goodness, it's a beautiful day. I think I'll go out and avoid illness and disease. I mean, it isn't the mover. It is, I want to do this, I want to do that, I want to have fun, I want to do it in a way that makes sense for the way I like to live my life.
Yeah.
What are your thoughts about this?
Well, first, when I wake up and it's a bright day like that and I have those thoughts, I think, well, I'm not going to go to the mall and touch the escalator handrails. That's how I avoid illness and disease. I think it's about contextualizing all the metrics that we're collecting for people and alerting them as needed, right? It's, again, to go back to an idea of like a stress score, right? If you notice the person's stress is high for a long time, suggest some meaningful things they could do right then in that context to relax. Do a breathing relaxation, maybe take a nap if that's what's needed. If you know that they haven't been sleeping and you know that that's probably contributing both to stress and higher heart rate and generally that they may be feeling down, try to suggest to them that a light workout might be better that day than their regular, I'm gonna go run 10 miles and then lift weights for 2 hours, right?
Sure.
Adaptive.
And I think, yeah, we have to give something back to the user. And with the right contextual data, with the right types of insights, the hope is that people will learn over time, oh, this is why I'm feeling good, and this is why I'm feeling bad. And I think that's, if the data is presented in the right way, will empower people to learn more about their bodies.
Yeah, so important. Nicolas.
I mean, fully agree with what was said before.
So let us each of you have a last comment of what you'd like to share to make a difference in people's lives in the world. Starting with whom? Who would like to go first?
Well, I'd love to talk to a lot of you guys. The real, I think the passion that I have is starting at first principles, science and engineering, and building from there all the way to the end user, and defining very specifically the theoretical limits of power and miniaturization of electronics, and building a foundation upon that to collect data that simply was not possible to collect otherwise, and find the right way, given all the complexities that we've been hearing about today, to really make an impact with that. It's not easy, but I think as a community we're making good progress.
One point, because I know you're really, really interested in miniaturization and micro-miniaturization. Can you talk a bit about the relationship between miniaturization and seamlessness?
Yeah, it kind of comes down to if we are trying to extract signals from the body and from, in the home, et cetera, we really need to drive down the size, drive down the cost, and drive down the cognitive burden to the user of using these technologies. In general, the smaller they get, the more inexpensive they will be, the more unobtrusive they will be, and the more seamlessly they melt into the environment.
Thank you.
Designing new devices that are totally seamless, totally invisible. Nobody wants to be patronized by a piece of technology telling you need to get more sleep, get up and move now. It's something different. So really, how can we embed this into people's everyday life, make it invisible, and then derive the right motivation, the right insights out of this?
You want to reduce irritation.
A little bit, yeah.
Travis.
User friction, right? I think I'll reiterate something I said earlier. And the key of Garmin Health's strategy is that it's an ecosystem play. We are not and can't be the platform in every single instance that can be meaningful for that person. And so my ask for everyone here, right, is that let's work together to try to create that end user experience, based on really quality sensor data and great hardware. I think all of us do that are up here, right? But really, come to us with your innovative ideas. We want to help you bring that to the user, to the person.
Listen, we want to thank all of you for joining us and being part of this superb first HLTH conference. Thank you so much.
Thank you, James, Travis, Brian, Nicolas, and Dennis.